Hi friends, welcome back to my channel. In the previous lectures, we have discussed introduction to complete dentures and diagnosis and treatment planning in completely edentulous patients. Today, in this lecture, we will discuss sequelae of wearing complete dentures. So, complete dentures for the edentulous patients can restore function, improve aesthetics, and enhance self-esteem. However, the oral cavity, irrespective of the presence or absence of the teeth, is not a static biologic entity. Time-dependent changes occur, particularly at the interfaces between prostheses and their supporting and surrounding tissues. Sequelae of wearing complete dentures. The placement of a removable prosthesis in the oral cavity leads to time-related direct and indirect changes in the oral environment. So the sequelae can be of direct and indirect. The direct sequelae are mucosal reactions, oral galvanic currents, altered taste perception, burning mouth syndrome, gagging, residual ridge reduction, periodontal disease, and caries. And the direct mucosal reactions often result from various mechanical irritation and the accumulation of microbial plaque on the dentures, and also infrequent toxic or allergic reaction to constituents of the denture material. Moreover, the long-term and continuous denture wearing also have a negative effect on the residual ridge form because of the progressive alveolar bone resorption. And the mucosal reactions are denture stomatitis, denture irritation hyperplasia, fibroepithelial polyp, flabby ridge, traumatic ulcers, and oral cancer. Let's move on to the indirect sequelae. So the indirect sequelae are atrophy of masticatory muscles, nutritional status and masticatory function. Wearing the complete dentures which function poorly and impair masticatory function could be a negative factor with regard to the maintenance of adequate muscle function and nutritional status, particularly in older individuals. Let's discuss direct sequelae caused by wearing complete dentures. This is an example for the mucosal reactions, that is mild to more severe. In the first and second pictures, it shows that mild to more severe palatal mucosal irritation and the infection, which suggests the stages in the development of dentures or mouth or denture stomatitis. And in C, an implant gingivitis, it is often referred to as peri-implantitis, and that's readily addressed with improved hygiene and soft tissue massage in the picture D. So in the picture D, it is improved due to improved hygiene and soft tissue massage. In this picture, it is clearly shown that a recently worn mandibular denture has caused a traumatic ulceration associated with peripheral overextension. So here it is a traumatic ulcer associated with the peripheral overextension of the denture, and in this picture it is shown that a very severe denture irritation hyperplasia is shown in the mandible, which is showing a central groove on the patient's right side in which the denture flange rests. That is indicated by the arrow mark. Okay. This is a picture showing Epulis fissuratum. Okay, it is otherwise known as denture irritation hyperplasia or inflammatory fibrous hyperplasia or denture injury tumor. Okay, the patients who wear ill-fitting dentures for a prolonged period of time may develop denture irritation hyperplasia. And such a mucosal hyperplasia, which develops slowly from chronic low-grade trauma, typically induced by unstable dentures or an overextended denture flange. This picture shows traumatic ulcer, which is caused by the overextension of lingual border of the dentures. Okay, and these are a breached surface epithelium, and they develop within 1 to 2 days after placement of new dentures. This is a picture showing flabby ridge. This is a mobile or extremely resilient alveolar ridge which occurs due to replacement of bone by fibrous tissue. And they provide poor support to the denture. And this is known as combination syndrome. That is the characteristic features which occur when the edentulous maxilla is opposed by natural mandibular anterior teeth, including loss of bone from anterior portion of the maxillary ridge, overgrowth of the tuberosities, papillary hyperplasia of the hard palate's mucosa, extrusion of lower anterior teeth, and the loss of alveolar bone and ridge height beneath the mandibular removable dental prosthesis. And this is also known as anterior hyperfunction syndrome. So the flabby ridge as a constituent of combination syndrome, it is given by Kelly in 1972. And this picture shows OPG which showing features of combination syndrome, that is overhanging maxillary tuberosity, extensive mandibular ridge resorption and extrusion of lower anterior teeth. Let's move on to the indirect sequelae caused by wearing complete dentures. So the first one is atrophy of masticatory muscles. The masticatory function depends on the skeletal muscle force and coordination of oral functional movements by the patient. The muscles of mastication have been discussed in detail in the previous lecture. And in general, bite force decreases with the age. A greater reduction has been demonstrated in the complete denture patients, especially women. In fact, CD patients need 7 times more chewing strokes than the persons with natural dentition to achieve similar reduction in particle size. And retaining a few teeth to support overdentures and the implant supported dentures has improved maximal occlusal force and the masticatory efficiency of completely edentulous individuals. Next one is the nutritional deficiencies. Severe deficiencies are rare except in hospitalized or chronically ill patients. In such patients, ill-fitting dentures, salivary gland hyperfunction or altered taste perception may have a negative effect on the nutritional status, and some improvement in nutritional intake can be expected following prosthodontic correction. So the dietary counseling and the mechanical preparation of food may be necessary to improve the nutritional status of the CD patients. In this lecture, we have discussed various direct and indirect sequelae of wearing complete dentures, and the denture stematitis will be discussed in the next section. Thanks for watching. Stay home, stay safe.